Hey guys, my name is Kay McDonald and I'm a master's level athletic training student at Texas Lutheran University, and today I'll be talking to you about muscle reaction time during a simulated lateral ankle sprain after wet ice application or cold water immersion. I left the citation to the article down at the bottom of the screen, so if y'all would like to go access this article, you can. It's free. And the purpose of this article was to figure out whether the muscle reaction time was altered or delayed or sped up um, after wet ice application or cold water immersion. So the methods that they used for this trial, they did a randomized control trial, and it was composed of 3 groups, and each group would receive a different treatment. So the independent variable was obviously the treatment. So group 1 would receive the wet ice application, group 2 would do the cold water immersion, and then group 3 would receive no treatment at all. And then the dependent variable would be the reaction time as well as the amplitude of the muscle. So for the participants, there was a total of 58, 30 men, 28 women, and the age range was between 18 and 25. Only 54 were able to actually complete the study, though 4 were excluded due to the criteria. So the inclusion criteria was that the participant must participate in a minimum of 1 athletic event per week. They have to have pain-free palpation over the anterior talofibular ligament and the calcaneofibular ligament, and then pain-free active range of motion of the ankle joint, which includes plantar flexion, dorsiflexion, inversion, and eversion. So the exclusion criteria, which was the 4 people, 3 of them had a previous history of ankle sprains, and then down at the bottom, the 4th one was prescribed orthos, but the other exclusion criteria was any injury during the time of the study, lower limb surgery, or an intolerance of ice or the cold. So the instruments that were used to complete this study was crushed ice, a cloth bag, a cool box, and water. So the data processing and results. The EMG machine was used to be able to measure the muscle activity and the amplitude of the muscle during the treatment as well as after the treatment to figure out if the muscle still had the same reaction time and amplitude. And then the results of this was that the muscle was not affected when it came to the reaction time. So in conclusion, the cooling of the joint did not affect the muscle reaction time. Athletes can safely return to play or to any kind of sporting event or activity after icing, and then the ice does not adversely affect the dynamic control of the muscle. So from a clinical application, I would start to apply ice or the cold water immersion before rehab or any kind of activity that the patient will be doing. And I would also use it through practicing games if there was a minor injury. So my main critique for this article was that it was a simulation of a lateral ankle sprain instead of an actual sprain. And so I would like to see those 2 things compared on how the results differed. And then for future studies, I would like to see how the wet ice application and the cold water immersion would affect the other joints of the body. That is all I have for you today, so thank you for watching.